We all have different doctors for different health needs, a primary care physician, a dermatologist, a cardiologist. But how much do these doctors know about the care the other is providing for us? Well, Dr. Fred Harvey is here to teach us about the concept of collaborative care. Welcome, Dr. Fred.
Thank you.
Well, let's start off with, we all think we might know what that term means, but what really is collaborative care?
Well, it stems from a public initiative. The government started looking at some data from even in the 1960s. They showed that about 60% of primary care office visits were driven by something emotional. And one health system, I think it was Kaiser, started having prepaid psychotherapy or behavioral visits. And it showed that when they got those visits, there was a 65% reduction in primary care visits.
Wow.
Oh.
And so there's an emotional component to everyone's illness and everyone's needs, and how much of that is driving visits to the doctor's office. So collaborating with other professionals, other than just doctors, actually really helps to bring up the value of healthcare and bring up the vitality of the population.
So in your example, you're talking about, mental health care with I'm going to say typical health care, but you're talking basically collaborative is any of your healthcare providers working together for the patient's care.
Yes, and in the definition from the government, it's behavioral specialist with primary care doctor, but I think it goes way beyond that. And I've had different practitioners in my office. I've had a massage therapist, an acupuncturist. Currently, I have a dietitian, because in functional medicine, the language is a little bit different from the usual dietetics. And so having a functional dietitian to help instruct my patients in these complex diets, like elimination diets and gluten-free diets, it really helps to have another coach there to augment it. And there's really good evidence for that too, that diabetes, kidney disease, obesity, if you see a dietitian for a couple of visits, you have better weight loss, better diabetes control, and slower onset of kidney failure to go to dialysis.
Well, as a patient, this sounds great to me. I can't
Makes
see that
sense,
there would be a
right?
downside, but why is it important to have everyone collaborating?
Well, if we don't have direct professional to professional communication, we miss things. We don't have all the information we need to treat the person appropriately.
Right.
And we can't rely on the layperson to bring us the message from the doctor. And in the
Because the patient isn't always well informed
Right.
with what they're taking or the things that they're doing.
It's so true.
Oh, interesting.
And so we need that extra level of communication, which in the 4-minute office visit era of insurance-based illness care modalities, we don't get that time. I have very few doctors that actually call me and collaborate from all the specialties. I have about 3 in town that we really have an ongoing collaborative relationship.
Is that the same concept? Because I was telling you earlier, like one of the things that we struggled with when my dad was in the hospital is one doctor would prescribe something that would have an adverse effect on his illness. So let's say he got a medicine and it dropped his blood sugar level, and then he was in a diabetic coma.
Right.
And then another thing would bring him out, and then another thing would bring him back there, and it was just a constant back and forth like that, where medicines were helping to make the situation worse.
Yes, I see that a lot in people with multiple specialists will have layers of medications that are actually chasing adverse consequences of other medications instead of treating the primary illness. And polypharmacy is a real big problem, which collaboration can help to eliminate.
Well, another concept that goes hand in hand with this is the patient-centered medical home. So what is that?
Well, that is another initiative that the government and the American College of Physicians, which is the Internal Medicine Society, the adult medicine group, has formulated to actually bring the behavioral specialist and the primary care doctor together in one location. And they don't have to necessarily be in the same office, in the same practice. It could be side to side in a building, but it makes more sense. I see it myself, because I use a lot of psychotherapists, all kinds of different specialties, but they're not in my office. And so I don't think of it first. If they were right there and we could have that relationship, it would
If you pass them in the
next
hall,
door,
you're more
yeah.
likely to communicate
Exactly.
with them.
And then we can collaborate at lunch and talk about the clients.
And so what would be the next step if a patient wanted to move to this type of a model?
Yeah.
Well, there's not much available at this point, but if you find a doctor, like a functional medicine doctor, that has more time to think about the referrals, I'm not saying that other doctors don't do referrals, they all do, but to have that collaborative effort, like me with the dietitian in my office, coaching people to use the dietitian, it's easier with her there than it is with her not there.
I mean, this is a great topic, and it's very important.
It
I know
is.
you host monthly Ask the Doc seminars, and you will be speaking on this very topic
Yes.
coming up on April 19th.
That's right.
So he'll be able to answer all of your questions on collaborative care. That'll be April 19th. You will want to register at theharveycenter.com. And coming up, he'll also be addressing future coming events this summer. He'll be addressing food and mood and men's health. And make sure to visit the events tab at harveycenter.com. All right, when we come back, we're turning to music with a local singer in our Sounds of the Suncoast.